This is episode 3. I'm Claudia Holly. I am Julie's assistant and a patient advocate.
And my name is Julie. I am the bathroom monitor and the practice manager for the Arthritis Center in Bridgeton, Missouri.
So, Julie's the queen of appeals when it comes to the entire getting a drug approved at all, let's be honest. You don't lose. She doesn't fight unless she knows she's winning. So let's kind of give them an overview of a prior authorization and your first steps.
Yeah, so first of all, just breaking down the words prior authorization, all right? So prior, before the service, authorization, permission slip, right? So it used to be back in the day, a million years ago, not even that long ago, 8 years ago, a physician's prescription, whether it be for a medicine or equipment, physical therapy, back brace, whatever, that was the physician's office's prior authorization. That there was no such prior authorization is like a made up shit word from the insurance companies and the PBMs. Okay, so the reason why we have to do them as physicians' offices is because these insurance companies and PBMs have gotten so big and so interested in funneling all the care into their profit centers. So that's what's happened.
I was gonna say it's definitely here. I'll stand too. Her hip's broken, so we're working with it. It's definitely increased in the time that I've been alive. Because in 3rd grade, I had surgery on my head. I guarantee you, with my family, we didn't go to bat, but we got it approved. There was not as, but now to get an MRI, you have to jump through 17 hoops and do the trapeze.
Okay, so here's the deal. Prior authorizations are just the insurance companies and their pharmacy benefit managers, PBM's way of funneling all patients into their one size fits all or one size fits most situation that's in their best interest. So that is maximizing profits for the insurance company and PBM's shareholders, as opposed to answering to patients, which is what we do in the doctor's office here. So prior authorization, it is permission slip for the doctor to write an order, be that order a prescription, physical therapy, an MRI, whatever it is. That's what a prior authorization is. And why does an insurance company and PBM want to put the brakes on this? Well, they're going to tell you that it's all in the name of cost-effective care. Well, we all know that's bullshit because there's nothing cost-effective about medical care. In fact, when you present an insurance card, all of a sudden your negotiated special price is way more than it would be if you just paid cash.
Well, you had a personal experience.
I mean,
like that.
I had a fall on the tennis court on January 18th. Today is February 21st.
Yep.
Boom. I still got it, folks. In the back. I see you. Okay, so I had a fall on the tennis court on January 18th, and I went to see an orthopedic surgeon. Actually, I went to see 2 different orthopedic surgeons, and they ordered 3 MRIs. One of my lumbar spine, because I've had a back surgery to fix a discectomy to fix an L5S1 issue in 2021. So they wanted an MRI of my lower lumbar spine, of my left hip, and of my left knee. And my insurance, Anthem, said, oh, no. That's not medically necessary. We don't really give a rat's behind if your husband is a physician or your physician. You're not getting this because it's not medically necessary. So what you have is you have insurance companies and PBMs putting a financial guard on what the doctor thinks is necessary. So even though I had prescriptions from 2 different orthopedics for MRIs of the lumbar spine, left hip, and left knee, my insurance company said, nope, not for you. So then Dr. Bach wrote an order because then Claudia prior authorized it for me. And Dr. Bach actually had to do a peer-to-peer with some moron physician, I shouldn't say that, with some physician who's crossed over to the dark side and works for the insurance companies to say no. And these physicians are actually paid on how many they deny. That the game of the game in the insurance industry is to deny and delay care. So we went through all of this rigmarole only to find out when I went to get my left hip MRI, I had to pay $29 more. No, that was the one. The left hip was the one I saved. I saved $7. I had to pay $392, and the cash price was $293. $393.
Yes.
It was almost $400. And the insurance, my stupid Anthem, saved me $7. I don't know where I'm going to go with that $7.
She can't even buy me lunch with that.
So then another week went by, and I went to go prior authorize my lumbar spine.
Because the pain didn't let up.
Yes.
She is in an excruciatingly amount of pain, and to where I get anxious.
I really am. I've got something going on with my my lumbar spine that's going through my left hip, my sciatica down my leg. So at any rate, I went to go get the MRI of the lumbar spine, and my stupid insurance, Anthem, said, okay, you can get it. I paid more to use my insurance than I would have if I would have cash paid it. So now I'm another $400 into this mess. Okay. So this is all these insurance companies are doing. They want to the prior authorization is a way for them to say, hard stop, we will control your care because you and your doctor don't know jack shit. Well, that's what a prior authorization is.
And this whole medical situation has really given us a bird's eye view as to what our patients are going through, because at least you have me that is directly, and our patients do have us, but they also don't understand the amount of work that takes to go into it, like the appeal, and that it can't just be done overnight like that, because we spent 30 minutes on the phone with that provider.
Easy. And the thing is, the prior authorizations, they don't prevent unnecessary care. What they do is most patients and most doctors, the insurance company, are banking on the fact that they're not going to want to have to sit on the phone with India and get transferred all over the place. Only 2% of doctors appeal a denial.
It's the expected amount.
Right. And 1% of patients. So we're going to actually do some interesting stuff. We have got a connection with
Creaky Joints
and one of their colleagues, and we're going to do a trial of 18 of our patients that are current HealthLink patients, because we had to terminate our contract, because guess what? I am also writing a check, Dr. Bach is, for us to care for these HealthLink patients. So in addition to all the nonsense prior authorizations and all of the hard stops, that is this in a nutshell. What a prior authorization is it's an emergency brake on your doctor. And if you want to pop that emergency brake and get through it, then your doctor or you as a patient better buckle up and get busy, because nobody is interested in having you get care with your crappy insurance. And I am speaking about myself. I have crappy insurance. I'm 58 years old and I have Anthem. Had the same crappy insurance for 9 years.
When does a prior authorization turn into an appeal? And what's the difference?
So a prior authorization, it turns into appeal the minute somebody appeals it, okay? But there's level 1 appeals, there's level 2 appeals, then this is the worst of the worst, is the peer-to-peer. I hope to God that these insurance companies, somebody told me that it costs them $80 every time that someone appeals it in writing. No wonder the insurance companies hate me. We appeal everything. And so you've got your prior authorization, which is a hard stop, no care for you. Then the doctor's office, us and our whole team appeal that, so that then a lot of times things will get overturned on that first appeal, because they know that these people,
she's going to keep going.
She ain't going to stop. But the ones that don't, we just ratchet it up.
Patient denial team.
Yes. And if we need to, we'll take it to social media, because public shaming is the new prior authorization.
Yeah, I don't think PR really knows how to handle the social media aspect, so they're kind of duck chickens with their heads cut off. Are there any resources that you'd recommend for people that are trying to get through the whole appeal and prior authorization process?
So the biggest the first thing I do when I'm looking at a case that's been denied is I print out the insurance card front and back. And I make sure I identify all of the players, because sometimes you have an insurance company, then you have a PBM, then you might have an interloper. Who's an interloper? That would be somebody like Archimedes, Smith RX, Quantum Health. I just had a case with them, and I emailed my 2 Quantum Health people that I've dealt with before and said, hey, want to buckle up, or you want to make this one easy? And they're both like, blah! Let me see what we can do to get the right person from our team on this. Again, making those inroads and pathways to success. This lady Lauren and this guy Patrick at Quantum Health, they already know that I'm the biggest bitch on the West, and I'm okay with that, because I'm doing it in the name of patients and access to care. So they might be a little more amenable to doing, to having a discussion with what we want to do as opposed to mandating to a pharmacy benefit manager, which is what Quantum Health is trying to do. So anyway, scrub that card. We really need to get a good example. We need to use.
We have the Vivio one.
Oh yeah, Vivio. There's so, I mean, but the problem is these interlopers pop up, 20 a year. So scrub that card as a physician's office. Look at that card. Google if the employer's on
LinkedIn,
there. If
everything.
the employer is on there, Google that. The chief financial officer, anyone in leadership, get an email address. I mean, I copied the world on whatever it is I want to get done. Like for PepsiCo, our patient that was stable until he took a job at PepsiCo. Like literally, I bet we had 30 hours into that case. But after it was successful, all of a sudden I got another PepsiCo patient and I got another one. But now I have a pathway to success. So once you start like getting success with this, I mean, my electronic filing system, I bet I have 400 folders in my filing system.
Her email alone, she has records upon records upon records.
I do.
I've tried to hack in to get the Claudia record to see what she's keeping on me, but I can't. But seriously, and there's been a huge break in like the whole prior authorization fiduciary with the Johnson & Johnson case.
Mm-hmm. Yes. So the prior authorization is literally a runaway train. That's what it is. And so because these insurance companies have so overcorrected, I have a Medicare Disadvantage plan that we recently terminated, but they're potentially crawling back to me. But they are so interested and so they're so obnoxious that they think their clinical decisions are better than ours. Not
Dr. Box.
Than Dr. Box, that they have us prior authorizing folic acid. Like, are you kidding me? We prescribe a lot of folic acid because you need to take it when you take methotrexate, and a lot of our patients are on methotrexate. Methotrexate is an extraordinarily inexpensive drug. Folic acid is extraordinarily inexpensive, but this damn Medicare Disadvantage plan thinks that they need to be involved to the tune of 7 questions for every 1 patient for methotrexate. We're not doing that.
And we're actually recommending a lot of our patients just cash pay.
And then we won't have all these burdens on inexpensive medicines because I've had it. I have 24 people to support 1 MD in this office, and that is largely because of the administrative burdens of the insurance companies and PBMs. So yeah, you have to work within the confines of this situation, but trust and believe if you are on the right side of this as a physician's office, dig in your heels and show them who's in charge.
Well, persistency is key, I feel like, and you really get that Sharpie out. And she faxes back to the pharmacy, like non-medical switch, not doing, patient abandonment team. The thing, because it goes into the record, right?
I'm a little salty, but by the time some of these PBMs and insurance companies really piss me off, I take a Sharpie marker and I write on the prior authorization or whatever it sounds stupid that they want us to do, and I literally write, CVS sucks. And then sometimes I get a call back and this woman says, I'm sitting here with a fax from you that says CVS sucks. I said, I know exactly what patient you're talking about.
Let me get it.
Yeah. I had another agent from Optum RX from Recredo who said, I'm sitting here, this was about 6 months ago, because now Optum doesn't want anything to do with me, but it's mutual. Call me, maybe we can make up. It's going to be on you to make the making up, not me. But Optum, I had another agent, her name was Tamika, and she has an email, and she's like, I'm not going to leave you. I'm going to get this fixed, and I don't know what's going to happen, but it's going to get fixed. And she's like, yeah, I got a fax that says Optum RX sucks. I'm like, that's me. Of course, in the long run, Optum didn't do anything, and Tamika stopped responding and gaslighting
bad
me.
Boyfriend.
But I still have her email address. I mean, these PBMs and insurance companies literally are like abusive relationships, except this old girl,
she's ready to buckle up.
I'm not crawling back, okay? I will fight with my words and with my actions, and I can tell you that my words and my actions are all in the spirit of what's best for our patients. So let's go, buckle up. Come on, put some gloves on. I'll meet you where you're at.
Well, and there's a reason you're a sought after speaker for many, many events. It's because you know what you're doing and you're successful with what you do.
Well, thank you. You know what? You miss 100% of the ones you don't you don't try for. So we're going to try for everything. We will go down fighting. That's what we do. That's what we need to do. Our patients can't handle dealing with these complex disease and fighting their shitty insurance company. So that's where we come in.
Yep. And if anyone, would you be willing to help anyone if they were to send an email to you?
Absolutely. I would be more than happy to help any practice, prior auth person or a patient. If they want to see how we do it, come on in here. Those who have nothing to hide, hide nothing. We are very successful at getting patients on treatment, and that's because we get patients on treatment. We will do whatever it takes to get the right patient on the right treatment. It is not one size fits all. It's not even one size fits most. There is a role for every drug in this office. And when that clinical team writes those orders, by God, we're going to make it happen.
Well, I think that's amazing. I think we've had a successful episode 3. We're going to have some guest speakers hopefully come in soon. And we're going to Oklahoma in April. We booked our flights. We're ready to go. So all of our FMMA members, shout out.
And we will be doing some live broadcasting from FMMA. Yes.
And Julie's surgery Monday. Don't worry. We'll be there. Like a day in the life of Julie's surgery might be next week's podcast.
Monday, 7 a.m.
Fantastic.